Hi, I'm Katie Richard, the Sports and Wellness Director of Thibodaux Regional, and I'm here today with some of our culinary medicine students who are in town this summer. So we just want to get to know them a little bit, have them tell you a little bit about what they have been learning. So first off, can y'all introduce yourselves and tell people where you're from and what field of medicine you'd be interested in?
So my name's Julie Barnes. I was born in Thibodaux. I grew up in Donner, Louisiana, and I am interested in going into family medicine.
I'm Omar Shabib. I'm from Alexandria, Louisiana, and I think I want to be an internist.
And so this is the 5th year in which Nicholls State University and LSU Health New Orleans School of Medicine have partnered to host the culinary medicine program at the Chef John Foss Culinary Institute. And we here with Thibodaux Regional Health System are so happy to be sponsors of this innovative program, where we were even able to host you at our wellness center.
So one of the main things that I've learned is that health looks different for a lot of different people. And with that, it's very important for us as future physicians to look at a patient holistically. Lifestyle is a big part of that, and food and nutrition is a great way for us to, teach and educate our patients on how they can make small changes in their lives to just make them feel better.
We were really lucky to have a dietitian on staff come and talk to us from a field of expertise about how to get all of your big nutrients like your proteins, your fats, and your carbs, but also the micronutrients, things like potassium or fiber that we sometimes don't really get as much in our diet.
So y'all both came and we took a tour of the Thibodaux Regional's Wellness Center, which I know y'all saw a lot of things. Can you share anything that you thought was interesting there, or that maybe was something that you would like to see in your own town?
For me, it was the WellFit program that had dietitians and nurses and lots of what seems like individual plan of care for certain lifestyle modifications.
And then also just like not a one-stop shop, but pretty close. So like physical therapy and the physical medicine and rehabilitation right next to each other, and those things go hand in hand a lot. So just a very convenient, well-rounded place for people to go for their healthcare.
So now, taking all of that, what you've learned through the program and seen kind of around here, if you were to say how this would help you in your future practice when you come out of school, have you found some things that you think will help you to be a better physician?
Yeah, so I mentioned I want to go into family medicine, which is, really treating the family as a whole. And that goes a lot into nutrition. We learned from Miss Allison this week that especially when you're raising kids, it's really important for the family dynamic to be there and, just teaching them, in a good way about nutrition. And that goes a long way. I'm a big, believer in preventative healthcare. So just making little changes.
I personally learned that healthy foods don't have to be boring, which I think is important, especially to learn how to do these things. Because if you're a physician and you want to counsel your patients on, I think we can start to incorporate certain changes in your diet. You're going to want to know how to actually do those things and make sure that the changes that you suggest and work with them to try to implement are actually sustainable and things that you can do long term. So.
Well, thank y'all so much for speaking with us today. Thank you for being here at Thibodaux and experiencing this, and we wish you great luck with your practice in the future.
Thank you
so much.